It was strange because I found out that I did have a diagnosis, and in a way that was a relief, but at the same time, it was bad news, very bad news. Hi, my name is Tim, and I have AL-type amyloidosis. So in 2018, I wasn't feeling good, and I was struggling with energy level. During the night, my wife would tell me that my legs would kick, and I would have leg pains during the day. My ankles started to swell. My primary care physician was concerned. It didn't seem that I could give him something concrete to work with. I was getting a life insurance upgrade, and they sent a nurse over to take my blood and urine, and then they reported back that there were very high levels of protein in my urine. With that diagnosis of AL amyloidosis, the oncologist that made the diagnosis, he forwarded me to Dr. Goldstein.
I'm Keith Stalker Goldstein. I'm a professor of medicine at Washington University in St. Louis and Siteman Cancer Center. Amyloidosis is a rather general term for the deposition of a specific type of protein into the tissues. There's over 36 types of amyloid-producing proteins that can lead to amyloidosis.
The two that you need to know are light chain amyloidosis, or AL amyloidosis. The second one is ATTR, or transthyretin amyloidosis. I'm Daniel Lenahan. I am a cardio-oncologist at St. Francis Healthcare in Cape Girardeau, Missouri. Amyloidosis is a complex condition that involves many potential causes. Some of those could be very rare genetic causes.
When my brother got diagnosed is when I realized that it was time for me, since it was so genetic and hereditary. My name is Mary, and I've been diagnosed with hereditary amyloidosis. I was diagnosed in April 2021.
So early diagnosis for amyloidosis is absolutely the key.
I started my treatment early, and I honestly believe that things were going downhill so fast that if my diagnosis was delayed by weeks or months, my story would be very different than it is. Dr. Lenahan prescribed the medication in coordination with the chemotherapy, but I was given drugs, and I would say by late December, I could sit up and down at will, and the thrashing of my legs stopped. I was doing chemotherapy once a week from, I guess I had my first treatment late November and through late February. The big win that my care team was working towards was for stem cell transplant. That was the right thing for me. There were some complications. But on the other side, my white cell count started to increase. By October of 2019, I had felt better than I had in years. By December, I was back in the office. I feel like I'm alive and doing well because of early diagnosis.
Most patients have symptoms for 6 to 12 months or even many years before they make a diagnosis of amyloidosis.
If you make a diagnosis late, the outcomes are not good.
Dr. Lenahan, he did everything he could to see if it had gotten into my heart. And once the amyloid was present in my system, I started taking difluzinol, which moves the protein around so it doesn't attach to your heart. Realizing that I have amyloid and that it's present in my system has made me much more aware of my daily activities.
Many of our patients have involvement in their autonomic nervous system. Their blood pressure will drop fairly dramatically. People can get very weak from that.
We really need to raise the level of understanding so that when you see these different things occurring, that you would consider amyloidosis may be present.
I don't feel that any of my physicians made a mistake or anything like that. But at the same time, I think amyloidosis could even be more prevalent than understood.
I was told in medical school that I may or may not ever see a patient with amyloidosis. In my current practice, I might make a diagnosis of amyloidosis at least once a week or maybe once every 2 weeks. When thinking about how to raise awareness of amyloidosis and improve general education. These things need to be emphasized, that there are new therapies, there are better ways of making the diagnosis, and many times it's kind of hiding in plain sight.
The reason we want people to be diagnosed earlier is we want the patients to be able to tolerate therapies as well as they possibly can.
Tim and Mary are perfect examples where early treatment with the currently effective therapies can really make a dramatic difference in how they're living.
There is no true cure for AL-type amyloidosis. The treatment options are better, or even better now, in the 3 years that's elapsed.
I'm thrilled with the progress that the medical industry has made with the diagnosis of amyloid. When I first was diagnosed with amyloidosis, there was only one medication that was available. And over the last few years, 3 different options have become available.
With the new therapies, we think that the earlier diagnosis and treatment could just have a dramatic impact.
Don't give up, because there is treatment and there is hope.